Here's an overview on Medicare. When you are first eligible for Medicare at 65, the way you're going to sign up is through the Social Security Administration. In order to be able to do that, you need to create a My Social Security account. You're going to do that at ssa.gov. And once you've become verified, that's when you can do a Medicare online application where you can sign up for Medicare Part A and Medicare Part B. If you don't like technology, you also can set up a phone interview to do your application. But in the meantime, through the Social Security Administration, you're going to start this Medicare journey by signing up for Medicare Part A, which is your hospital coverage. It's a $0 monthly premium typically if you have 40 work credits, and Medicare Part B, which is everything outside of the hospital, and most people pay $185 a month in premium. Once you have submitted your application with the Social Security Administration, your work is not done. But before we go on to the other job that you have, I want to give you the assurance that when you're signing up for Medicare, all you're doing initially is A and B. The rest of the decisions come after that. So let's talk about the other decisions. You are going to make a decision. Are you going to stick with the original program, original Medicare, or an alternative program, Medicare Advantage? So let's start with this side of the chart. For those of you who are going to stay with this side, it means you're going to have the federal government as your insurer, the Centers for Medicare and Medicaid Services. That is the original Medicare program. Now, the way that Medicare is designed, it's not designed to cover every dollar. So when you have a Medicare approved claim, while Medicare covers 80% of a Part B bill, there's a 20% gap. And there are some other additional gaps, which is why you want to consider getting a Medicare supplement policy. Most of my clients are in Plan G or N. I'll do a different video on that, but G is a little more expensive than N because with G, you do not have any copays. When you get a Medicare supplement policy, that means you're going to have additional premium. But by paying that additional premium, you can cover most of your out-of-pocket costs that are not covered on a Medicare-approved claim. So I've expressed you, the Medicare beneficiaries, take steps to sign up for A and B. By the way, for those of you already taking your Social Security at least 6 months before your 65th birth month, you should get that card in the mail without having to take any steps about 3 months before your 65th birth month. So watch for that. But in the meantime, how do you sign up for a supplement? Well, you could work with an agent like myself. You could talk to your local SHIP office, get advice there, or you could do your own research. But again, this is something that you do once you know you're signing up for Medicare, but it is not through the SSA. And it could be done typically up to 6 months before you're starting, but that's not necessary. But if you want to get off your checklist, you could do that. The next thing you need to do is sign up for Medicare Part D if you want prescription drug coverage. You're going to choose a plan based on you, on your medications. You're going to look for that most cost-effective plan. Typically, you're going to have premium and some copays. And it is a separate program where you do have to take these steps. You need your Medicare number to do that. Medicare Part D wasn't even offered till 2006, whereas the original program was offered in 1965, which is why this is an additional sign up and it's not part of what you do when you sign up at the ssa.gov. Now, you may be considering the other side, Medicare Advantage. So when you hear about Medicare Part C, that is Medicare Advantage. Now, some people think, oh, if I go to C, I don't have to pay for B, but that is incorrect. Even if you're going to switch to Medicare Advantage, if you leave the federal government program, you're still responsible for paying for Part B. But what about for Part C? Are there costs? Well, typically, Medicare Advantage plans have a $0 premium, but you have something called a MOOP, a max out-of-pocket you could spend. Each plan defines what that max out-of-pocket is. Let's say it's $5,000. That's not an upfront cost. That's not like a deductible. It just means that's the most you could spend. And each time you have a service, you may have a copay or a coinsurance. So how do you sign up for this alternative private managed care program? That is going to be the same way again that you would like a supplement, where you do it through your agent or you go to your local SHIP, or you do it online. But the bottom line is that's not what you do when you go through SSA.gov. Now, in addition to this Part C coverage, most people have built in Part D. So you don't get a standalone D plan. It's going to be built in, and that's where you're going to get your prescription drug coverage. Any copays that you'll have for your medications are going to be on top of that max out of pocket that I mentioned. Now, if you're choosing one of these, like a Part C plan, it's really important that whoever helps you make sure your doctors are in network, that your drugs are covered by the formulary, that they're cost effective. When you're on this side of the chart, you can see any doctor in the United States as long as they accept Medicare. This side is more about networks. You also have to know when you're in Medicare Advantage, you typically need prior authorization for the different services that you seek out for medical care. So this is just a broad overview. Obviously, there are a ton of things you have to think about when you're deciding between the two paths, but hopefully this gives you that overview to understand how you got to get the wheels in motion for this process.